Okay, well, good morning, and we'll go ahead and get started. You know, I'm happy to say that Iowa's COVID cases continue to trend in the right direction. The number of Iowans tested has now exceeded the 200,000 mark and currently stands at a per capita rate of 1 in 16 Iowans have been tested. There's been a total number of tests done. That number is 232,000, so that includes some of the repeat tests that Iowans now have an opportunity to do. So over 2,000 individual Iowans have been tested and 232,000 tests have been completed. In late April, when the virus activity and surveillance testing was increasing, we hit an all-time daily high of 791 positive cases, and our overall positivity rate reached a high of 30%. Since then, positive case numbers have been consistently trending down. Our average positivity rate is currently at 11.1%, and yesterday our daily positivity rate was 5.4%. Overall, hospitalization rates also continue to trend down. In early May, we saw a high of more than 400 COVID-19 patients hospitalized. I think it was 417, and we had 164 Iowans in ICUs. Since then, these numbers have gradually and consistently decreased and again continue to do so. Currently across the state, a total of 245 COVID-19 patients are hospitalized. That's down from 255 yesterday, and it's down from 394 a month ago. We have 73 patients in the ICU. That's down from 82 yesterday and 152 a month ago. As virus activity increased in some areas of the state, hospitalization rates in specific regions also increased temporarily for a period of time. The Regional Medical Coordination Centers, or RMCCs, responded as planned, helping coordinate the transfer of vents and other medical supplies to hospitals in need, and or assisting with the transfer of patients to other facilities for care. But throughout this time, critical healthcare resources, including ICU beds, vents, remained stable across the state, and most importantly, Iowans received the quality of care that they needed and deserved. Our PPE inventory has also grown to serve the immediate and longer-term needs across the state. We now have a minimum of 14 weeks of supply in all essential PPE categories, and we continue to build both regional and state stockpiles capable of providing a combined 90 days of supply to area healthcare facilities. We've also seen our testing capacity increase significantly statewide. Iowa's major healthcare systems are processing COVID-19 tests in their hospital labs. The state hygienic lab has processed more than 80,000 tests from Iowans, more than any other lab serving our state. And Test Iowa has tested more than 36,000 Iowans since April 25th, the day that the first site opened, and they've tested more than 25,000 were tested since May 22nd, when testing criteria was open to anyone wanting tested. So the 25,000 were tested since May 22nd. By testing more Iowans and through our robust case investigation process, we're better able to track virus activity, understand its scope, and monitor trends over time, whether that's statewide, county, community, or right down to a zip code. It also allows us to track the recovery rate of those who have been sick. Of more than the 22,500 Iowans who have had COVID-19, more than 13,500, or 60%, have recovered, and 55% of all long-term care staff and residents that had the virus have also recovered. Additionally, 11 long-term care facilities where outbreaks occurred have now been removed from the outbreak status after having had no new cases for 28 consecutive days. Our ability to quickly identify an uptick in virus activity enables us to potentially identify, again, emerging hotspots early and get ahead of outbreaks that could develop as a result. Equally important, the data also informs important decisions regarding our economic recovery and getting life back to normal. Results such as the consistent downward trends in positive cases and hospitalizations that were experienced for the last month allow us to confidently take additional steps forward, further relaxing restrictions and reopening businesses through a measured and responsible approach that's driven by data. Effective Friday, June 12th at 8 a.m., the 50% capacity limit currently in place for businesses will be lifted, while retaining the requirements of 6 feet social distancing for certain businesses like restaurants, bars, and theaters. Eliminating the capacity restrictions will allow businesses the flexibility to adjust their specific operations accordingly to best meet the needs of their employees and customers. Establishments shall implement reasonable measures to ensure social distancing, increase hygiene practices, and other public health measures to reduce the risk of transmission of COVID-19, consistent with the guidance that's been provided by the Department of Public Health. Swimming pools may open under these same guidelines, and senior centers and adult daycare programs may also open if they comply with specific guidance being issued by the Department of Public Health. These changes are a result of the positive forward momentum that we're generating in Iowa, and we must keep it going. So we know that COVID-19 will remain in our communities for a while, but we also know what we can do to effectively mitigate and manage and contain it while we safely and responsibly move forward with life. It remains just as important now as it did 3 months ago that every Iowan continue to do their part to protect the health and the health of their health and the health of others, especially those who are most vulnerable. This morning, I've asked Dr. Badati to talk about the ongoing guidance from the Department of Public Health as we continue progressing through our recovery phase. Dr. Badati. Whoops.
Thank you, Governor, and good morning, everyone. So first, I want to start by thanking all Iowans for everything that you've already done to help limit the spread of this virus. I know that this has been an incredibly challenging time, and I know that all Iowans have made adjustments in their daily lives to help keep our families and our communities safe. I want to encourage everybody to stay informed and to continue to use good personal protective measures to help to limit the spread of this virus. So as we dial back on some of the mitigation strategies that we've used as part of this response, it's a good opportunity to review what some of those public health strategies are. It's important to remember that any Iowan that falls into a high-risk group, so that's going to include people who are older than 65, people who have underlying conditions like chronic lung disease or serious heart conditions, individuals in those groups are still going to want to stay home and avoid group settings as much as possible in order to protect their health. It's also okay to continue to stay home if you don't fall into those groups. Each Iowan should decide what's best for them and what might make sense for their circumstances to keep themselves and their families healthy. Now, doing things like staying home when you're sick, which is what we call isolation, and then staying home when you're exposed to somebody who's had COVID, which is what we call quarantine, continue to be very important ways to help limit the spread of this virus. So in particular, when we talk about quarantine, that's going to apply to people who are currently healthy, but who have had an exposure to somebody who's had COVID. And this is an important thing to do because if you stay away from other people for a period of 14 days, if you were to become sick, there would not be the opportunity to spread that virus to anybody else, and so it stops the transmission of the virus right there. Now, if you're not in a high-risk group, and if you're feeling well, and if you've not had a concerning exposure, and you're going to be outside of your home resuming activities, it's still important to follow public health guidance. So that's going to include things like taking steps to maintain at least a 6-foot distance from others and washing your hands frequently to help further limit the virus's ability to move between us. Also, using a cloth face covering if you are unable to maintain a 6-foot distance from others is going to be yet another tool you can use to help limit spread. Now, it's important to remember that if you're going to wear a face covering, you want to make sure that that's covering your mouth and your nose, and it should fit closely to your face. You don't want to be touching the outside of that mask, and if you do have to touch it or adjust it, you're going to want to immediately wash your hands. And those kinds of cloth face coverings should be changed after each use and cleaned, or if they become visibly dirty. Now, throughout this response, the Department of Public Health has provided guidance that Iowans can refer to as we start to get back to the ways that we live, work, and interact with each other. And we want to continue to do these things in a very safe and reasonable way, and so you'll continue to find guidance, including information about the topics and items that the governor mentioned on both coronavirus.iowa.gov and idph.iowa.gov. And that's also going to include guidance like the things that I've just discussed, as well as other measures that we talk about, like frequent cleaning and disinfecting. So overall, I think this has continued to be a very rapidly evolving response, and the department remains committed to stopping the spread of this virus and keeping Iowans informed and healthy. I encourage everyone to use the practices that I've described to help slow the spread of COVID-19. And these kinds of practices are also going to be really helpful in limiting the spread of other diseases. So they're going to continue to be important things to do as we move forward to help protect our health and the health of our communities. Thank you.
Thank you, Dr. Padati. I just so appreciate your partnership throughout this process, especially as we continue every day to learn more about COVID-19 and apply that information to our strategy to manage the virus and protect the health of all Iowans throughout this time. I am proud to say that we continue to add testing sites, which we think is critical in our ability to manage and contain. On Monday, we announced 5 new Test Iowa sites, including 4 clinic sites that are partnerships between the state and local healthcare providers to increase access to testing in rural Iowa and rural communities. Clinics operate and staff the test sites while the state provides testing supplies and processes the samples, again, through the state hygienic lab. Test Iowa clinic sites are now available at West Burlington, Waterloo, Clarinda, and Creston. 2 more clinic sites are opening in Carroll and Crawford counties. Both will be operated by St. Anthony Regional Hospital. One site opens today at the hospital in Carroll, and the other site opens tomorrow in Denison at St. Anthony Clinic. We're working with other healthcare providers in communities across the state and plan to open additional clinic sites next week, including one in Osage in partnership with the Mitchell County Public Health to, again, further expand access to testing in smaller communities where it is just otherwise limited. We do have a couple of our drive-through sites, Des Moines and Cedar Rapids, that will be moving to new locations in those communities. The Des Moines site currently is located at the Iowa Event Center's north parking lot. It will move to Polk County River Place at 2309 Euclid Avenue in Des Moines. And the Cedar Rapids location, currently at Kirkwood's Community Education Training Center, will move to the Iowa DOT District 6 office at 5455 Kirkwood Boulevard in Cedar Rapids. Both moves will occur when testing concludes at 6 p.m. on Friday. Each site is being relocated so that businesses can resume as usual at the Iowa Events Center and at the Kirkwood Community College. And again, I want to thank both organizations for working with us to help launch Test Iowa sites in Des Moines and Cedar Rapids. Testing will begin again Monday morning at the new location, so be sure and complete an assessment at testiowa.com and schedule an appointment if you want to be tested at one of the Test Iowa sites. And remember, that is one option. If you are feeling any symptoms and you're having trouble scheduling, be sure and call your physician. So this is one option to get tested. You also have the option to go through your healthcare providers and call a clinics if that is necessary. So with that, I'll open it up for questions.
Governor, a couple of weeks ago, you said you were meeting with the Iowa State Fair Board telephonically. What was your recommendation to them about the 2020 Iowa State Fair?
Yeah, so I'm not making a recommendation to them, Kay. They actually gave me an update on what they had been working on. They'd sent out a survey, some of the things that they were taking into consideration, some of the shows that had canceled and what that looked like moving forward, and how they were going to continue to look at all the information to get kind of where we were at as a state. So I was able to give them an update. This is a snapshot in time of what currently was in place. So we walked through some of that, but mostly that meeting, Kay, was an update on their part to talk about what the board had been working on, the survey that they're putting in place, that looking at, if they can actually pull off a fair with reduced attendance, and so they were doing the due diligence and gathering the information to provide the fair board members. So it was more an update.
Given your announcement today about businesses opening at full capacity, does that inform their decision?
Well, I mean, they'll have to decide that, but we have to continue to practice social distancing. I'm taking the 50% capacity off, giving somewhat flexibility to businesses and how they can make sure that they're protecting their employees as well as their clients. And so the same thing would would apply. Dr. Badati, I think, has walked through what we need to continually keep in the back of our mind as we continue to recover and move forward with opening the state back up. So they'll have to continue to take all of that into account. And you have to remember, they've had a lot of participants that typically make up the Iowa State Fair that are not going, that have already canceled. So that's some of the things that they'll have to work through when they meet as a board. And I stand by whatever decision they make. I appreciate they've really been thoughtful in taking the time. They've not rushed this decision, giving Iowa and Iowans an opportunity to respond. And so they could wait as late as possible to see where we were at in a very evolving and rapidly changing environment to make those decisions. So I appreciate them really taking the time to do that.
Dr. Padati, is there any public health advice for if the fair should go forward, or thoughts about whether that's advisable?
Yeah, so again, I think that the things that I described earlier are all the things that I think we'd want to be keeping in mind regardless of what setting or situation we're talking about, right? And those things are all based on what we understand about the virus, and so that's what's informing these recommendations. And that's why we continue to talk about things like people who are at higher risk, should avoid group settings, and using all of the techniques like staying 6 feet away from others, practicing frequent hand washing, and all of those things. And they're going to continue to be important things regardless of which setting we're talking about at this point. They're also going to be important things for a variety of illnesses they help protect against. So these are all good general public health practices that we want people to continue to follow.
Governor, what's your take on Senator Smith's bill as it relates to absentee voting and Secretary Pate sending out those absentee ballot request forms? Do you believe Secretary Pate did the right thing by doing that in the first place?
Well, he sent out request for an absentee ballot, so I think that was fine, and I'll wait and see where they end up with the legislation. It's been a long-standing practice of mine not to comment on legislation until I see it in its final form, and this applies to that as well. So I know they're having conversations and they're discussing, and I'll wait and see where that ends up, and then we'll review it like I do every other piece of legislation and move forward.
Governor, upstairs in the Capitol today, there are members of Black Lives Matter who have some demands for the legislature. Have you met with any of these members of these groups, and do you have a position whether you would support any of the demands that they've made?
Well, first of all, I made it very clear that I'm committed to sitting down and having a conversation, to most importantly listening and talking about what we need to do to continue to move forward. I don't know if they've specifically asked for a meeting with us, but I've made it very clear throughout the week. We've met with community leaders to talk about how we can move forward, to talk about how we can bring groups together and sit down in front of them and listen to what they're experiencing, and talk about having, quite frankly, some pretty tough conversations about what's taking place and how we can collectively put together long-term and lasting reform. And so we're meeting with the legislature right now, both parties. We've had some really, really good conversations regarding some 3 issues that the minority party brought up at their press conference. And so we've met for the last 3 days. My hope is that we can stand before Iowans and have a bill that is unanimously passed and signed by the governor. That's a starting point. It's certainly not it's not the end, but it's a starting point. And so, we just need to do what we can to continue those conversations and continue to move forward.
Would that bill include the 3 recommendations that the Democrats
Well,
made
again, I'm
last
not gonna, we're still working on that, and we're doing that in earnest. We're having a conversation, but I thought it was a reasonable place to start, and so we've had some really good conversations, and I'm hoping we can get that finalized today.
And just to follow, just to clarify,
Yep.
the folks who were here today, you did not meet with them?
No, I did not.
One of the aspects of, I guess, opening up further is the idea that there may be some people that go to a business or work for some place that gets coronavirus. there is an effort to shut down or at least limit severely the ability for someone to sue.
Yeah.
I guess that seems to favor business interests more than it does the interest of the individual who may get sick. I guess I'd like to know what your position is on
Yeah,
that.
I think that's an unfair statement. I don't think that that's accurate. What I've experienced from businesses that I've worked with, that they have gone above and beyond to do everything that they can to not only protect their employees, but to make sure that they're protecting their clients that come in. So it's a balance. I think it's very hard. It would be very hard to identify where somebody was exposed to the COVID-19. I mean, look at the protests that have been taking place over the last 10 days. So you go back to work, how can you determine where and when you came in contact that somebody, with somebody that potentially had COVID-19? So it's just, I think, almost unreasonable. But what we can continue to do, David, is to provide testing, to work with our businesses, to give the employees the assurance to test multiple times to make sure that they're still testing negative at that time, to identify maybe somebody that was asymptomatic that tests positive. So we can do the case investigation and start to identify what the scope of that looks like. So, and people need to practice personal responsibility. If you're going to participate or do things that where we're not, implementing 6 feet social distancing or not wearing a mask, then you're subjecting yourself to potentially getting COVID-19. So we all have a role to play in that. So.
Governor, this morning the House Appropriations Committee met to look at their proposal for a budget. Democrats were critical of the House Republicans' proposal, which would give you and the Department of Management really wide authority over spending the federal funds that are coming into Iowa right now. Do you think that you should have that authority without checking with the legislature? And what do you plan to do to be transparent?
Well,
about
you're
those
assuming
funds?
that I didn't check with the legislature, and that's not accurate.
Okay.
I have done a lot of outreach with associations and businesses and communities and healthcare providers. I've been on a conference call with the Iowa State Association of Counties. I spent 20 years as a local government official. I've reached out to the League of Cities. We've done a lot of outreach and, to try to understand the cost and the impact, to make sure that we're using the FEMA dollars that are available, to make sure that we utilize those appropriately. Then the 25 cents percent now is we can use the CARES dollars for the 25% as well. So I've tried to do it with, not me personally, but I've done some of it, but the team has done a lot of outreach to make sure that we're being responsible in using the CARES dollars. So
Part of the issue with that bill that they're talking about, the way they're passing the budget, is the lack of oversight that the legislature will have going forward for the next year's budget, and a concern of openness. Can you guarantee Iowans that you will be open?
yeah, in fact, I talked about if you heard me at one of the press conferences, I actually talked about making sure that it was automated and that we had a portal so that Iowans can see all of the requests that are coming in and how all of the dollars are being expended and allocated. All of that will be transparent. It will be on a portal. Not only does it provide transparency to Iowans, but it also streamlines the process. We're doing entirely too much manual applications in agencies across the state, and we can do better. We should do better. Businesses are doing better. A large chunk of the funding is going for broadband expansion. If we're going to be able to educate, telework, and provide telehealth, we have to have the capacity to be able to provide that so that we're ready to meet maybe a resurgence or anything that might be taking place. And so, we're just going to operate differently, and having broadband connectivity is a huge component of that. And so a large portion of that, of those dollars, as many other states are doing, will be allocated towards that. A good chunk of that is going to local government to continue to work with them to offset some of the costs that have been related to COVID-19. They have to apply the same criteria that we do as a state. It can't be used to backfill budgets, but it can help alleviate some of the overtime and extra cost that's been associated with COVID. So, I'm not trying to hide anything. We're trying to be as transparent as possible, and this will give Iowans an opportunity to weigh in.
Just circling back to
Yeah.
the absentee ballot issue.
Yeah.
What went wrong in the primary election this June that needs to be fixed?
Kate, I haven't seen the new legislation. I haven't sat down and read it, so I don't know. I haven't had a chance to take a look at that, but we'll take a look at the legislation and see where that ends up.
Aaron Murphy, go ahead.
Thank you, Governor. I'm just speaking of that budget. What the House has started moving is essentially a status quo budget. Is that roughly in line with what you were expecting or hoping to get done? Is that enough? Is that sufficient in your view?
Yeah. Well, unfortunately, it's reflective of what the REC put forward, so that gave us some guidance in what we needed to do. We're very fortunate that Iowa was in a very good fiscal position. From 2019, we ended the fiscal year with almost a $300 million surplus. Our cash reserves are full, and the Taxpayer Trust Fund has some funding in it as well. So we're in a good spot to move forward, to really absorb. We didn't have to do any cuts for the fiscal year that we're in right now, and I think it's it was similar to the budget that we had worked on too, and I think it's a great approach.
Courtney, go ahead.
Yeah, Governor Reynolds, you were talking about lifting the capacity requirements and making sure that people maintain that 6 feet distance for bars, restaurants, and theaters. What about salons and tattoo parlors?
Same thing. I mean, we lifted the percentage. We have in place the social distancing and 6 feet requirement to make every reasonable attempt to address that. But I think what you'll continue to see is, again, businesses want to do the right thing. They want to make sure that they're protecting their employees as well as their clients. And so I have full expectation that the majority, you always have some people that don't, but the majority will do everything they can to continue to open up in a safe and responsible manner. And when I was talking about the budget, I think it is a responsible budget that has been put forth by the legislature. We have been working collaboratively, and I think that was the right approach moving forward.
Last question, Eric Waverly, News, go ahead.
Thank you. I had two questions, but the first one was addressed by somebody in the room there. But the second question is about the bottle deposits. With the original order, you suspended all bottle deposit returns until further notice. When are you going to be lifting that, or do you have an idea when you will be lifting that? Because frankly, I've got 724 packs of cans sitting at home.
I know. So I'm sorry about that. Thank you for being responsible. I think that the current proclamation will run through the end of June, and then we'll revisit it at that time. So we continue right now, it's still in effect. We'll continue to revisit some of the regulatory requirements that have been lifted through the proclamation, and so probably the next update will be in a couple weeks on that. So thank you.
Thanks, everyone.